Welcome to Bowie News and Views. I'm John Rouse, your host for the day. And I'm very pleased to have with us a guest, a Bowie physician, Peter Ekberg. Welcome to the show.
Thank you, John.
I should, in the interests of candor, tell you that he is our family physician. And the only thing that he has not been able to do over the year is save my hair. But other than that, he's been very good.
Well, we can work on that.
We can work on that. Well, I think it's beyond time now. As you know, I talked to you earlier about it. We now have a health bill.
Yes.
Signed by the president, ready to go into effect. And we've heard endlessly the windbags in the Senate and the House going on and on why they hate it, and the bloviators on cable TV, why it's anti-American and communism and fascism and all this other baloney. I think you may have had time to at least read the basics like I have. What are your feelings on this health plan? We need it?
Oh, yes. I mean, it's definitely needed. I mean, it was needed a long time ago. I mean, they've been working
since Eisenhower, isn't it? No, earlier than that.
Well, before that. I mean, if you go back historically, I mean, there was a congressman back in 1916 who gave a speech in Congress lamenting the fact that the United States was the only industrialized country that did not have some government-sponsored form of medical insurance. Right. And then they started trying, the first major reform, I think, was during the Roosevelt administration, when they instituted Social Security. And which created a furor. Yes, it did. But they tried health care at that point, and then it was tried again in the 50s under Truman, and it failed. And then in the 1960s, when Johnson instituted Medicare and Medicaid, they again tried for a more generalized health care bill, but that failed, and they've been just trying off and on ever since. So this has been almost a century.
Well, it's certainly needed. We were talking earlier. I'd just like to point out something for people who don't know it. Not without a national health service, some of the countries I compare this figure to are fully nationalized health providers. The United States per capita expenditure on medicine is $6,719. The UK is $2,800, a national health service under which I lived for many years, and it works very well, and they don't have death panels. Germany, $3,400. Canada, right north of us, $3,600, and so forth and so on. It goes on and on. And despite all that money, the United States, the World Health Organization, ranks the health system in the United States 37th, which absolutely blows my mind. Infant mortality, we were also discussing, is very, very, very high. As a matter of fact, infant mortality rate's 33rd in the country. Now, for all, and you know, these people, the bloviators, are constantly telling us we have the best health system in the world, and I think these facts belie that. Would you agree or would you disagree? Oh no, I would agree. I mean, certainly it's a well-known statistic that we spend 17% of our gross domestic product on health care. The next closest, one of those European countries, I think, is about 9.5%. So yeah, a little less than half of what we spend. And those statistics include a lot of things besides you know, hospital care, physician care, pharmaceuticals. Right. They do. They break it down. But where we get, you know, we vary from category to category. But where we rank number one is cost. Yes. Certainly, if someone has the money and they have good health insurance, they can get some of the best care in the world here. Unfortunately, that does not apply to the vast majority of the population, and there are large sectors that are totally left out. 46 million. Without any health insurance. With no health insurance or inadequate health. That's well, no, that's the people without health insurance. Then you talk about all the people that have inadequate health insurance. Many people that are on state medical assistance programs and things like that. And I mean, it really is a large percentage of the population.
So that's why you end up with statistics like the infant mortality rate,
Yeah.
which, I mean, even in the Western Hemisphere, compared to Central American countries, we rank below them, and South American countries.
Yeah, that surprised me.
Yes, and it is appalling, and it should not be occurring. But hopefully, this expansion of the health insurance to larger proportions of the population will begin to remedy some of that, and that's important because one of the terms that people are frequently using is the health care reform. Well, this bill really has nothing to do with health care per se. I mean, the care that people are going to be getting.
Yeah, true.
If you go to a hospital, you go to your doctor, is going to be the same for all intents and purposes. It's really just expanding the medical insurance to a larger pool of people to get them into the system and the care that they need. Fortunately,
one of the provisions, I think it goes into effect immediately, is they can no longer turn down people with an pre-existing condition. I read a story in the New York Times, and it blew my mind that they have turned down children mm-hmm. who have perhaps cancer, or they have a condition that is not going to be really cured per se, but can be maintained. They turn them down for mm-hmm. insurance. Mm-hmm. They can't do that anymore.
Well, I think it is important to understand that yes, this is an appalling thing for them to do, but this is what insurance companies do. This is how they make their money. I mean, insurance companies, by their very nature, exist to make money, to make a profit, and they do that by risk adjustment, okay. by taking people that have low risk mm-hmm. and getting their money, and avoiding people with higher risk, mm-hmm. and so that they don't have to pay out money. And whether you're talking about automobile insurance, or whether you're talking about life insurance, the medical insurance is in the same category. And so they're really just doing what they exist to do.
True.
And I think a big part of the problem has been our unfortunate reliance in this country in having these private medical insurance companies driving the whole medical insurance industry, whereas that's really what was needed was a readjustment of the medical insurance industry. I mean, right now. The statistics are about, 50% of the population is getting their medical care through a socialized or government-run health insurance, either Medicare, Medicaid, or through the VA system.
I know people tend to not really realize that Medicare is, I want socialized health.
Yes, and it is somewhat surprising that many of the people out there protesting the health insurance reforms, you can see they might be gray-haired senior citizens that are on Medicare complaining about government-run health insurance.
I know.
I mean, it's rather ironic.
There, yes. I saw some of those folks last week. I couldn't believe the horrible outpour from these teabaggers and these others that were down there protesting as they were about to take the vote. I mean, from racist terms to homophobia, all this over trying to give the American people a better health system.
Mm-hmm. Yes.
What is the matter with these people?
It is hard to understand. I mean, people certainly can have differences of opinion on how we go about doing something.
But we can be civilized about it.
Yes, absolutely. And certainly there are concerns with the huge deficits our government is running about how we are going to pay for some of these things. But that's just the nature of paying for any program, whether it's the military or
wars,
or, infrastructure or medical care.
Yeah.